Welcome to The Explainer. Today we're talking about something super important, the subtle early signs of ovarian cancer. We're going to break down what the experts say you need to look for and really why listening to your own body is maybe the most powerful tool you have.
So let's start with a number. In the US alone, around 20,000 people get an ovarian cancer diagnosis every single year. And to really understand what that means, it's the 5th deadliest cancer for people with ovaries. That's why spotting it early is just so critical.
Okay, so that's the big question, right? Why is it so sneaky? Why is it so hard to catch in those early stages? Well, the answer actually starts at a size you can't even see.
When it first starts, the cancer cells are literally microscopic, so you can imagine the signals your body sends out aren't like these loud, blaring alarms. They're more like quiet whispers, and that's what makes them so easy to brush off or mistake for something minor. And that right there brings us to what might be the single most powerful tool we have for catching this early. And it's not some fancy, high-tech machine or a complicated test. Nope. It's something you already have, the ability to really, truly listen to your own body. And this is such a key point. Gynecologist Dr. Rebecca Brightman puts it perfectly. She says that you are the #1 expert on you. You know what's normal for your body. So when you get that feeling, that little gut instinct that says, hey, this is different, that's not just a feeling, that's data, and it's incredibly valuable.
And why does this matter so much? Dr. Mary Rosser really drives home what's at stake. Getting diagnosed early isn't just a small leg up, it's a total game changer. It fundamentally flips the odds in your favor because you can start treatment that much sooner.
Okay, so what are we actually listening for? What are these signs? Let's dive in, starting with the ones you might notice in your abdominal and pelvic area, because these are some of the most common. All right, take a look at this list. Bloating, feeling full fast, indigestion, cramps. I mean, who hasn't felt these things, right? They seem so normal, and that's the tricky part. The key word here, the thing you have to lock onto, is persistent. It's when these things show up and just don't leave.
Yeah, let's zoom in on bloating, because this one is huge. We all get bloated, right? After a big meal or for other reasons. But that's not what we're talking about. The kind of bloating that gets doctors' attention is the kind that sticks around. It's there day after day. It's not just a temporary thing, it's a constant.
So if you go to your doctor and say, hey, I have this bloating that just won't quit, one of the first things they might do is a transvaginal ultrasound. It's a way for them to get a really clear picture of what's going on with your ovaries, uterus, and fallopian tubes to see if anything looks out of the ordinary. You know that bloating and the feeling full quickly thing? They're often connected. What can happen is a fluid buildup. It's called ascites that literally pushes on your stomach. So of course you'd feel full after just a few bites. And if that's happening and you're also losing weight without trying to, that's another major red flag.
Now, let's talk cramps. It's so important to be clear here. We're not talking about your typical menstrual cramps. The kind you need to pay attention to is cramping that's new, that's persistent, there's that word again, or, and this is a big one, any cramping at all if you're post-menopause. Okay, so those are the pelvic and abdominal signs. But here's the thing, the symptoms don't always stay in that one area. Let's look at how this can actually show up in other parts of your body.
Persistent back pain, needing to pee all the time, strange bleeding, even trouble breathing. I know, at first glance you wouldn't think these have anything to do with your ovaries, but they absolutely can be important clues.
And that back pain, Dr. Marlene Myers, an oncologist, really helps us define it. It's the same rule as before. Persistence is key. It's a new kind of pain that just hangs around, and you can't trace it back to something obvious, like, oh yeah, I overdid it at the gym yesterday.
And what about feeling like you have to pee constantly? Well, there's a really simple physical reason for that. A tumor in the pelvis can literally press on your bladder. It's simple mechanics. That pressure is what creates that feeling of, I gotta go now, all the time. Okay, let's touch on irregular bleeding. While it is a possible sign, it's really important to know that it's super rare. We're talking only about 1% of cases. It's linked to a very specific kind of tumor that actually produces estrogen, which explains why it might cause unexpected bleeding.
So knowing all of these signs is the first crucial step, but just knowing isn't enough, right? It's what you do with that knowledge that makes all the difference. This is all about turning that awareness into action.
When you boil everything down, all the expert advice, all the data, it all comes back to one simple, incredibly powerful idea. Early detection is everything. It's the key. And if you want to know why it's the key, look at this number, 94%. When this cancer is caught and treated early, the 5-year survival rate is around 94%. I mean, that's just a huge, hopeful number, and it shows you exactly what's possible.
So what's the takeaway here? The path forward is actually pretty simple, and it's really empowering. It's just 2 steps. Step 1, notice. Pay attention when something in your body changes and sticks around. Step 2, advocate. Take what you've noticed and talk to a doctor. Be your own best advocate.
And we're going to leave you with this one last question. Just take a second right now and check in. Listen, is your body trying to tell you something? Because paying attention, well, it could be the most important thing you do all day.